National Cabinet has asked the nation's top medical task force to consider how the country can drop isolation rules for close contacts of COVID-19 cases. The Prime Minister insists it's the next step to getting back to some level of normality. Political reporter Matthew Doran has more from our Parliament House Bureau in Canberra.
Well, Meredith, the focus of yesterday's meeting was on how the nation will be preparing for both the mix of COVID-19 and potential flu cases when winter starts to hit, but also looking at the changing dynamics in Australia when it comes to dealing with the pandemic. Those booster rates that continue to climb, the need to try to get more people back to work, and also the opening of Australia's international borders, what risk that is actually playing with regards to how COVID-19 is developing and continuing to spread across the country. And a key focus of the meeting yesterday was this issue around isolation requirements. They have already gone through a few different iterations for people who've come into close contact with a known COVID-19 infection. But as those cases continue to climb and as the threat continues to change, the decision was taken by the Prime Minister, Premiers and Chief Ministers to try to axe those isolation requirements as soon as possible. Now, the way in which the nation will go about it is still up for debate. The decision was that the AHPPC, which is the nation's top medical task force, would go away and trying to come up with a plan for how those isolation requirements should be scrapped. But the Prime Minister very keen to stress this morning when he was talking to reporters just outside of Sydney that this is something that all leaders across the country are keen to see, even if it is at slightly different times depending on the jurisdiction.
Starving businesses of staff, of hospitals of staff, and all of these things, although for the health sector there have been some exemptions. And for people who are running hospitality businesses and things like that, the close contact rule, particularly with the kids back at school, I mean, we all know what it's like with kids and flus and other things. They bring it home and then the whole family has to stay home and can't go to work. So that rule is becoming, we believe, as leaders, redundant. So we've tasked the medical expert panel to say, want your urgent advice on this as soon as possible, because we'd like to say goodbye to that rule as quickly as we can.
And Matthew, what concerns are there about the upcoming flu season?
Well, Meredith, this could be the first actual flu season that we've seen in a couple of years because of the fact that the international borders have been closed for a number of years now, and throughout much of the pandemic there have been quite strong restrictions in place, limiting movement, limiting circulation of people. So we haven't actually seen that many flu cases popping up across the country, and with fewer cases, of course, also fewer deaths from the flu. So the message that was coming out of federal government yesterday and National Cabinet after that meeting of the Prime Minister, Premiers and Chief Ministers is that the nation's health system is preparing for this intermingling of COVID and flu in the next couple of months. The modelling on exactly when the highest number of cases is still being done, but there is a quiet confidence that the health system can hold up and deal with those two viruses as they are spreading through the community. Another thing that we will start to see in the next couple of months, particularly in hospitals, is a PCR test that will actually test for not only COVID-19 but also influenza A and influenza B. That is going through the last stages of testing, with authorities hoping that that will be rolled out in the next couple of months.